I'll teach you guys. Okay. The body desensitizes, it becomes less responsive to the medication. So this is why we're always looking to optimize the metabolic response with lifestyle. Welcome everybody. If you just joined us here today, this bright and early morning. My name is Dr. Jones. I have clinics we service across the nation, all 50 states. I work with my medical practitioners. They prescribe. And I coach. So we have like a really cool kind of way that we approach this. I live in Denver, Colorado. But yeah, I live in Denver, Colorado, but we service all 50 states. So this has allowed us to really, everything we do here has allowed us to really isolate the common factor here, like what's actually happening. How do you guys get long-term success? And so we'll go over all of this stuff with you today and keep it locked and loaded. And because I do these free coachings every single day, looking to help you guys be as successful as I possibly can. I've debated stopping due to Vyvanse. I'm fine. I'm not eating it. Yeah, I mean, do you really? You know, my question is do you really need the Vyvanse? Do you feel like you really need additional medications in that category? Hey, Doc, we got a doc from Romania. That's super cool. I would love to go to Romania. What's it like out there in Romania? We go grab. I need to get my lighting going. We need some more light in this room. You guys are welcome. I appreciate that. And today, I'm going to answer all your guys' questions. We're going to focus on the category of sustainable weight loss. I want you guys to be successful. I want you guys to learn how to utilize these medications correctly, safely, staying on the lowest dose possible. What peptides to stack with your GLP-1. That's a big deal. There's a lot of really cool peptides that you can actually stack with your GLP-1s. My favorite peptide is AOD 9604. So we'll teach you guys about that one, how to stack it, all that kind of stuff. Slow responders. So I want to talk about slow responders. Slow responders, it doesn't exist. I'm not a big fan of the term. I'm not a big fan of this term, slow responder. The reason why I'm not a big fan is because I think when you start to call yourself a slow responder, there seems to be a little bit of responsibility over the situation that decreases, right? The moment you say, I'm a slow responder, now all of a sudden you become a slow responder, if you know what I mean. But there's so many things that you can do to speed up your results
that you just don't know. You haven't learned that GLP-1 medications reduce insulin resistance. They reduce inflammation. And guess what? Guess what else does that? Guess what else also improves metabolic health? We have a couple things that does that. Fasting, intermittent fasting, and long-form fasting. When you take those periods of time when you're not eating, your body improves, your metabolic health improves. Chua Merverga, watching me on YouTube, currently on Semaglutide and TRT. Since starting this protocol, I am dropping 1.2 a week on average. I even take a shot every 2 weeks. That's fantastic. I think when you get your hormones in balance, when you balance out your hormones, testosterone, your sex hormones, as well as your metabolic hormones, this is what the GLP-1 does, that's when everything works in harmony, and that's when you can get the best possible results. So I'm super happy to hear that. Rose A. In the UK, you have to start on 2.5 and work your way up. Okay, to lose 14 kilos, how long will it take? Well, it's the same way here, Rose, in America. The healthcare system here, what they do is they just continually escalate your dose. Every 4 weeks, people get increased. Every 4 weeks, people get increased. And I have a problem with that dosing schedule because it doesn't allow the individual, it doesn't support the individual's ability to do better, right? Like, what does that even mean, do better? It means that you are implementing the proper lifestyle interventions. There's so many other categories of your health that you can fix, that you can improve with proper lifestyle. And I'll teach you guys all of those things today. The right type of fasting, the low carbohydrate eating, carnivore, how that works, resistance training, how to build muscle mass, hypertrophy training, how to improve your sleep, how to reduce your stress, how to reduce your inflammation. All of these things matter significantly. And so that's why you're here. You're here to learn, and I'm here to help you guys understand this stuff. Yes, the healthcare system is very broken. If you have steady weight loss monthly, increase in dosage is not mandatory. I agree 100%. Rosa and my cats, Bedar and Sophia. Yes, you and your cats are correct. I wouldn't increase the dose. Lady, is there a peptide to stack with Tirzepatide that helps me with energy? See, there's no direct peptide that works on energy pathway, right? Energy is the byproduct of many things, one of which is good mitochondrial function. So if your mitochondria is not functioning as well, then your energy is going to drop. That's MOTS. If you're highly inflamed, you're not going to have energy. BPC, low dose naltrexone, GLP-1 can help that. If your testosterone is low, your energy is going to suck. If your thyroid is low, your energy is going to suck. If your cortisol is high, your energy is going to suck. So, this is one of those things that, unfortunately, I see a lot of people talking about, oh, take this for energy. And I'm like, you're so full of shit, because you can't guarantee that hitting that one pathway is going to have any positive impact. It's like I said, it could be any one of those things causing your low energy. And you don't know until you get in there and do some proper testing and start making some educated guesses. Yes, these peptides work for both men and women. Good morning, Favorable. How are you? There's no follow-up where, Levy? Selena, Manila, should I rest between strength training days if I'm on a GLP-1? Absolutely. Strength training is the most important thing to do during your my phone just dropped. Strength training is the most important thing to do. One of those most important things to do to build solid muscle mass. I mean, resting in between your strength training isn't a variable because you're on GLP-1s, right? You should always have some rest days. Devin on YouTube, what's the optimal number of total testosterone and free testosterone to build muscle mass, assuming all other health markers? There really isn't an optimal number. I hate shooting for certain numbers. It's not a game I would recommend playing. When you use testosterone therapy, it's to treat an issue. It's to treat a problem. Low sex drive, low confidence, low energy, less responsiveness to workouts, things like that. So that's what you're looking to improve with testosterone. Usually when you get on TRT, total testosterone upwards around 1,000 is a good metric to shoot for, but I just wouldn't arbitrarily shoot for those numbers. What do you think about metformin plus Ozempic? I see that there are many doctors stacking Ozempic and metformin. I mean, look, they're both going to drop that blood sugar. So if you're dealing with an overweight diabetic, then absolutely, they need as much intervention as you can. If they're non-diabetic and they're on a GLP-1, you could still add metformin. Metformin is that, by preventing the glucagon release, going to promote additional weight loss. So with our approach, though, with the AOD and the GLP-1, I haven't seen too many people fall into that bucket where we had to add extra metformin. It just hasn't came up yet. Talia, I'm still losing weight, but the food noise is extra loud. Should I go up on my dose, or tips to help? So was the medication working before and it stopped working, or what exactly happened? Absolutely, doctor. Jazz, does your heart rate have to be elevated to lose weight? When I do my upper body, my heart rate stays low. I don't know why. Your heart rate does not have to be elevated to lose weight, but you do want to elevate your heart rate for cardiovascular benefit. So with the exception of some unique medical condition that I'm not even familiar with, chances are you're not putting in as much effort as you would need to in order to increase your heart rate. Like if you went for a jog, would your heart rate increase? I can almost guarantee that it would. Well, that took more effort on your body. Jenny, GLP-1 journey. I'm stalled. What is the best peptide to help? So we get this question a lot, and I want to address it because I think it's so important to understand. You don't take peptides to fix a weight loss stall. That's not what you do. How many of you watching this live this morning are currently stalled on your GLP-1 medication? Let me know in the comments, are you stalled? And what dose, or how long have you been stalled? How long have you been stalled for? And what's your dose? What's the best thing to take with the GLP-1 to lose weight fast? So, AOD. You stack AOD 9604 with a GLP-1. You're gonna optimize the results. You're gonna increase the fat loss, and you're gonna protect against muscle mass loss. Jerome on YouTube. I'm thinking about taking my Zepbound shot a day earlier because I'm headed out of town next week. Shot day is on Thursday, planning to inject on Wednesday. Any thoughts? Yeah, I mean, depending on what dose you're on, it's usually not that big of a deal. I would talk to your doctor and see what they say, but sometimes people, you know, if it's more than 2 days out, it's better just to skip and then resync up the next 7-day pattern. Yes, we do offer retatrutide. Sandy, how about L-carnitine and arginine? Yeah, L-carnitine and arginine is great. You can't go wrong there. Those can potentially help. Not usually nothing that is earth-shattering. I have not stalled yet. Week 8, 2.5, 12 pounds down. Aiming to continue another month. Suppression is good. That's fantastic. Any thoughts on splitting the dose? Some people do better when they take their weekly dose and they split it. And that's definitely more true when you're on retatrutide. Hey, Anna, how are you? I'm trying retatrutide 2 mgs a weekly for 4 weeks now, and I've lost 4 pounds. That's freaking great. Moss Man, where you been at, bro? I've been here every day. You know me, man. I've been going live every day. I just haven't seen you. So Glow is a combo of peptides, the BPC 157, TV 500, and GHK copper. We sell all those peptides individually. Guys, we do prescribe peptides from a 503A pharmacy. If you guys just hopped in to this live this morning, welcome, welcome. So my name is Dr. Jones. I have clinics we service across the nation. Have a good day, Anna. Thank you. Good seeing you. We service all 50 states in America, and we prescribe, we'll start with what we have, all the GLP-1, Semaglutide, Tirzepatide, and retatrutide. We have the powerful fat loss peptides as well, AOD, Semorelin, Tesamorelin, CJC, IPA. We have anti-aging therapies like methylene blue, testosterone, TRT, MOTC for the mitochondria. And then we like to stack everything with coaching. So the coaching, me and my coaches, what we do is we're working with you on an individual to ensure that you implement the necessary lifestyle changes so that you're successful long-term, maintaining your weight loss. So the Glow peptides, a lot of people are using Glow for healing and for reducing inflammation. So you can do that with the Glow peptides. You can also supercharge it with carnivore diet. Yeah, there's quite a few things you can do there. Healthy lifestyle, second week of TERS, and I haven't lost anything yet. It's barely week 2. You need to take a deep breath. You need to relax, and you know, ask yourself this question: what other lifestyle interventions have you implemented while you're waiting for the medication to work? while you're waiting for the results to kick in, what are you doing on your part? What changes have you made to your lifestyle? What is the best peptide to build muscle while still using Retta? Probably testosterone, which is not even a peptide. If your testosterone levels are not optimized yet, optimal, if you have symptoms of low TT or of like, brain fog, tiredness, anxiety, depression, lower sex drive, lower confidence, things like that, then you would benefit from adding muscle mass. I'm live right there. Love you. Now your face is on the live permanently. Boogie Brewster says 100% inspiring. Thank you, buddy. By the way, this phone number right here, the 229 number, this is the best way to reach out to my team. All you got to do is shoot us a text message and be sure to include your name and your email. Let them know that you want to get set up for a free consult. Good morning, Guy. What's in the program? Is it coaching only? No, we tailor the program to the individual based off of their needs. So we like to start off with comprehensive labs. The labs allow us to assess, what's going on and get a clearer picture, and then we can make specific recommendations. There's so many different options: peptides, hormones, anti-aging therapies, different specific lifestyle interventions. What is realistic for you as a patient? Are you going to adhere to carnivore? Or are you telling Dr. Jones, go kick a kite? I'm not going to do carnivore, right? So we have to figure that out. And in that process, that's what we do. So everything is customized and tailored to the individual. Basic changes, calorie counting, macros, prioritizing protein, hydration. Yeah, what kind of exercise are you doing? Resistance training is always the most important and foundational piece. Yeah, we work with a lot of PCOS cases. The GLO peptides are used for reducing inflammation, improving healing, anti-aging, anti-inflammation, skin health is what GLO is used for. It's kind of like a very versatile combination of peptides. I think, honestly, looking at the dosing that they got on the GLO, I don't even agree with the dosing. I think there's better dosing options out there with different peptides. Hello from Dubai, family physician. Hey, I really appreciate that. That's the second doctor we had on this morning. We had a Dubai physician. We had a Romanian physician. Thank you for staying tuned and connected. Yeah, I do my best to try to help you guys out every day with as much information. Why do I not respond to GLP-1s? I've tried so many peptides and got nothing. Yeah, because your body is likely has a roadblock to healing. Your body likely has a roadblock to weight loss. And no peptides, no medications. We can keep throwing the medications and peptides at you, and it's not going to work. You could have a dysfunctional thyroid. You could have an inflammatory storm driven by autoimmune disease. You could be very, very insulin resistant. Your cortisol levels could be really high. Those are the 4 main reasons, by the way. Cortisol, thyroid, inflammation, and hyperinsulinemia. These are the 4 main reasons why an individual would be struggling to lose weight on GLP-1s. My sound keeps going off. All right, give me 1 second. I noticed this VPN thing is acting weird. Give me 1 second. All right, how about now? Is the audio smooth or? Okay, good. Yeah, cortisol. Oh, that's what happened. I know what's happening here. So my fiance, okay, I fixed it. My fiance jumps in the car, and when she takes off to the gym, my car syncs up to the car, or my phone syncs up to the car. So that's an interesting thing that keeps happening. Can you repeat what you said? Main reasons people are not losing weight. Yes. Here are the 4 main reasons why you are not losing weight on your GLP-1 medications. Pay attention to this one, because you absolutely need to focus on one of these 4 things in order to fix your weight loss. Number 1, hyperinsulinemia. Hyperinsulinemia is a medical condition that means chronically elevated insulin levels. In a normal, healthy body, you're not supposed to have insulin levels remain elevated throughout the day. Even if you ate a bunch of sugary meals throughout the day, if you're insulin sensitive, your insulin's going to spike up and your insulin's going to go down 6 times throughout the day if you ate 6 times. But as you start to become more insulin resistant, your body starts to decrease responsiveness to insulin. Your body's ability to compensate is via increasing the production of insulin. So your body has to make more insulin to compensate for the decreased responsiveness in order to keep your blood sugar under control, because keeping blood sugar under control is fundamentally important for the body. So by doing that, your body makes more insulin, but when it makes more insulin, guess what? More insulin means more resistance. So it's the lifestyle and many other factors that lead to the resistance of insulin, which leads to the production of more insulin, which leads to the production of more resistance. And it's a very vicious cycle. And you end up becoming hyperinsulinemic, where you hit this point where it's just your insulin is just elevated all the time. You have resistance and your insulin levels are elevated. Also, we usually see leptin resistance at the same time. Leptin resistance, insulin resistance, hyperinsulinemia. That's number 1. Number 2 is inflammation. So inflammation is almost always elevated in any sort of non-optimal health situation. Autoimmune diseases, non-autoimmune inflammatory conditions. So in the autoimmune conditions, like very often lupus and Hashimoto's and rheumatoid arthritis, you have a dysregulated immune system targeting certain tissues for destruction. So produce antibodies. The antibodies are flagging the tissues, and then eventually at the right time, stress triggers, various triggers. A lot of times it could be environmental. You get this inflammatory storm. So when you have autoimmune disease, you have elevated inflammation. Inflammation, guess what? When inflammation is elevated, it drives insulin resistance. So, and then same thing with non-autoimmune inflammation as well. So PCOS, menopause, Lyme's, post-COVID. All these things can drive your inflammation and drive your insulin resistance. Number 3 is thyroid. So thyroid function is necessary for the conversion of the food that we eat into the energy that our body uses, ATP. And so you have to have a healthy, optimal thyroid level. And so this is why we do a very functional thyroid panel, looking at free T3, free T4, reverse T3. And then finally, cortisol. If you're not sleeping good, if you have stress in your life, your cortisol levels could be elevated. Elevated cortisol leads to elevated blood sugar, and that leads to elevated insulin, and you're right back into that same path. Wolverine is just the most effective healing peptides. Yeah, our clinic works with men and women to help balance out their hormones. So testosterone therapy, TRT for men, bioidentical hormone replacement therapy for women. So menopausal women, definitely if you're suffering from night sweats, from hot flashes, helps a lot. Best peptide for muscle growth after you optimize your testosterone. I would say any of the 2 main growth hormone peptides, CJC 1295, ipamorelin. Those are growth hormone peptides that stimulate the release of your body's own growth hormone, and growth hormone is going to help build the muscle. Well, we weren't talking about any sort of healing in particular, but musculoskeletal healing. So like injuries of your body, sprains, strains, tears, things like that. The glow and the Wolverine are going to help with that. They're also going to help reduce systemic levels of inflammation. I'm getting a dopamine hit just by watching you walk. Heck yeah. I like this little treadmill here that I have. I'm walking at, what speed am I walking at? 2.2 miles, 2.3. I'm walking at 2.3 miles per hour. I'm getting just a slight elevation of calories burned. Yeah, Graves' disease is an autoimmune condition. Generally, Graves' disease exhibits a hyperthyroid, usually. So if you have Graves, you have a faster thyroid hormone production. You have higher levels. So usually, again, not every case, you're going to see weight loss, like lighter, not difficulty losing weight. It's going to be difficulty gaining weight. Rachel is walking 2.8 miles per hour. She had to one-up me. Way to one-up me, Rachel. I'm totally kidding, by the way. Is it safe to do a 72-hour fast on tirzepatide? So I can't give you medical advice. Now, I can tell you that we have a really good coaching platform, and we have, like, what we do is we implement flow. Flow is our structured approach towards metabolic health and longer fasting. So we like to get our patients into deep weekly longer rounds. Yeah, I mean, I don't know what dose your cousin's on, but if she's dealing with side effects currently, ginger is really helpful. Any form of ginger, really. Sniffing alcohol prep pads seems to be very beneficial for a lot of people. I walk an hour in the morning and 30 minutes after lunch. That's fantastic. That's cool. Yeah. I think walking's, if you have time, you can get in your schedule sometime. That's great. It does not replace resistance training, though. You have to resistance train. But as long as you are getting resistance training in, any walking you do is also beneficial. Can you be on HRT and GLP-1 at the same time? Absolutely. You absolutely can. Gingivitis. What about gingivitis? I don't think anyone's ever asked me about gingivitis. We got some dentists up in here. Maybe we got some dentists that can talk about gingivitis. Boogie Brewster, that's really kind. Your words mean a lot to me. Thank you so much. Jenny, how do I lower my cortisol? I'm afraid I may be stuck in fight or flight due to some traumatic things that happen. Yeah, any of those adaptogenic herbs, ashwagandha, holy basil, panic ginseng, rhodelia. But if you've been through trauma, then I suggest that you figure out what you need to do to work through that trauma, because that, depending on the intensity of the trauma, there can be some lingering stimulatory effect of that. You said any type of ginger. Yeah, but gingivitis is not a type of ginger. Week 2 of Tirzepatide, I have no appetite suppression. Will I have to increase my dosage? Well, do you feel like you're still struggling to make dietary changes? Like, remember, what's the point of the medication? The point of the medication is to optimize your lifestyle, reduce the food chatter so that you can improve your eating, your nutrition, because you're eating a bunch of crap. You're eating too much crap, the wrong kind of stuff. And so you add the GLP-1s to give you better control over your diet. Yeah, if you're really tired on your GLP-1 medications, it's likely because you're not getting enough nutrition in the body. Yeah, Rick's just shoot a DM to the page and then pin the DM up top. I took my first shot of Mounjaro yesterday night, and today I feel so normal. Nothing changed. It was your first shot, my friend. Dang, everybody's hoping that within the first shot their lives are going to transform. These expectations that have been created around GLP-1s. It's pretty wild, right? I want immediate results right now. One shot, change everything. Doesn't work like that, but you do have the power to optimize your results. You do have the power to improve your results, but you got to put in that effort. Not a magic wand. This is a magic wand. I have a magic wand right here, but the GLP-1s is not a magic wand. So unless you go to Hogwarts and get yourself a magic wand, you guys are going to have to put in the work. I use Manjaro. Lisa, hello. Last stone, and it's like a flipping miracle drug. I have control. That's awesome. Yes, we do work with perimenopausal, menopausal women. I have some really awesome women's healthcare practitioners. How much time after GLP-1s does it take to see results? It's different for everybody. Depends how impacted your health is, number one. And number two, it depends on how much effort you're putting into lifestyle. Are you making the necessary changes? Any additional ways to lose the love handles? I went from 42 to 34 in 14 months. Chad Wuck. That's fantastic, my friend. For men, the love handles are the last area to go. So you're going to have to get more aggressive with your fat loss efforts. Are you a physician that prescribes the medications? JRT, yes. So I own clinics that service across the nation, all 50 states. So by texting us, what's going to happen is you're going to get a booking link. I recommend that you set up a consultation with my team, with my experts, have a conversation about what you're looking for, what your goals are. They'll make a recommendation. They'll go over pricing, and then let's kick some butt. That's how that works. And then we work with high quality 503A pharmacies that will ship directly to your doorstep. Yes, we do have glutathione. Uh, 20 pounds in 2 months is possible, but I don't know how much your deficit is. I don't know how much, I don't know anything about your health. So sure, it's possible. A lot of things are possible. Maybelline, on second dose of Wegovy, my sugar craving noise has gone. Also menopausal. That's fantastic. I love that. I love that you're kicking ass. I love that you're putting in the effort. It's tough. It's tough when you're menopausal. It becomes more difficult for your body to lose weight. It really does. Mile on treadmill this month. Jason, was that a question or I'm not sure? Andrea, you don't believe in calorie counting. It's not that I don't believe in calorie counting. Calorie counting works for people that can do it. Most people will not maintain counting calories for an extended period of time. So it only works if you can do it, but most people can't do it. Therefore, it doesn't work. Does that make sense? The people that can do it, though, they do great, and they get the kind of result they were hoping that they got. So